hygiene skill. So first I'm just gonna turn the water on, adjusting the temperature. I'm just gonna wet, making sure not to touch the inside of the bowl. Working my hands into a lather. Washing my wrist. And underneath my nails. Making sure not to shake my hands. Okay, Miss Mouse, so I'm just going to provide some catheter care for you now, okay? All right, so I'm going to lift up your gown, okay? And I'm just going to cover you up, making sure not to overexpose you. All right, so I'll get the first washcloth, wring it out, apply soap. I'm going to spread the labia, okay? I'm going to hold the catheter 3 to 4 inches away, and I'm going to clean from top to bottom using a different part of the washcloth each time. Okay, then I'll dispose of that washcloth. I'm going to get the rinsing washcloth, wring it out. Using the technique, I'm going to spread the labia, rinse, and then holding it 3 to 4 inches away, I'm going to clean from top to bottom using a different part each time. And then one last time, I'm just going to dry, spreading the labia, holding 3 to 4 inches away, using a different part to dry. I'm going to dispose of my used linens correctly. I'm going to empty, rinse, and dry the basin and dispose of it in the dirty supply area. Recover the patient. Remove the linen protector. Make sure that the catheter is placed correctly, making sure that there are no kinks or tangles in it. Making sure that it is not raised above the knee so that it does not cause any clogging. Again, disposing of these. Once I'm done with that, I'm going to remove my gloves and wash my hands. All right, Miss Miles, now I'm going to provide you with some foot care, and then I'm going to transfer you from the bed to the wheelchair, all right? Is that okay with you?
That's all right.
Okay, so I'm going to make sure that I have the basin filled with water at the appropriate temperature, which is 105 degrees Fahrenheit or 40 degrees Celsius. I'm going to put my washcloths into the water, making sure that I have the basin up at the level that is comfortable for the patient. I'm going to ask you to scoot up just a little bit. Bless you.
Bless you.
Okay. And if you could just put your foot into the water. Is that comfortable for you?
That's fine.
Okay, I'm going to allow the foot to soak for the appropriate amount of time, which is 10 minutes. For the sake of the video, I'm just going to continue on. All right, so first I'm going to get the first washcloth, bring it out, apply the soap. Okay, and then I'm just going to wash the top of the foot, making sure to support the foot. Okay, using a different side of the washcloth, I'm going to wash the bottom of the foot. And then using another side, I'm going to wash in between the toes. Okay, then I'm going to get another washcloth to rinse. I'm going to rinse the top of the foot, the bottom of the foot, and in between the toes. Okay, and then I'm going to get the towel to dry the foot. From top to bottom and in between the toes. Okay. All right. And then I will just dispose of the water. I'm going to empty, rinse, and dry the basin. And dispose of it in the dirty supply container area. And dispose of my used linens. And after that, I'm just going to apply some lotion to the top and bottom of the feet, not putting it in between the toes. Then I'm going to be sure to wipe off any excess lotion. Okay. And again, disposing of all of my linens properly. All right. Now, Ms. Miles, I'm going to place the gait belt around your waist. All right, Ms. Miles, so now I'm just going to transfer you from the bed to the wheelchair. Okay, so before I do that, I'm just going to prepare the wheelchair. I'm going to make sure that the leg support is open and away from the area that the patient has to stand. I'm going to make sure that I lock the wheels on the chair. And then I'm just going to make sure that the padding on the inside of it is clean and is prepared for the patient. Okay, so now I'm just going to place the gait belt around your waist. Okay. Ooh. Making sure it's not too tight. All right. Maintain a broad base of support. And then on the count of 3, we're just going to lift up. 1, 2, 3. Okay. And then we're just going to pivot to the chair. Okay. Are your legs on the back of the chair?
Yes.
All right. And you can sit down, making sure that your back is on the back of the chair. Okay. Are you good?
I'm good.
Okay. So I'm going to make sure that our feet are up in the footrest. And then I would walk with her around the area. So I would make sure that I walk to the right of the hallways, making sure that I stop at intersections. Also making sure that I do not turn, always backing up. I will walk backwards onto elevators and ramps. All right, and then I will turn her back to the room. Would you like to stay in the wheelchair or would you like to get back in the bed?
I like to stay right here.
Okay.
This is comfortable.
Great. All right, now I'm just gonna check your respirations, all right? Okay. All right, so I will record that her respirations are at 17. So I would write R17, deep and strong. After that, I will just remove my gloves. Make sure the call light is in reach of the patient, and then I will wash my hands and report any abnormalities.